Hello everybody, my name is Dr. Ram Krishnan Nair. I'm a consultant emergency physician. I'm also the Chief Executive Officer of JeevaRaksha Trust. You are here today because you've kindly volunteered to take on the responsibility of looking after patients who are at home after having been diagnosed as COVID positive or have symptoms of COVID infection, even though their test results have come back as negative. As you know, given the scale of pandemic that India is dealing with at the moment, and the fact that 90% of the patients are asymptomatic or mildly symptomatic, keeping these people safely at home ensures that the valuable resources like beds in COVID care centers, oxygen supplies, as well as intensive care unit beds in hospitals can be utilized for the most needy, those patients who have got significant symptoms and are becoming moderately or severely unwell with COVID. So your contribution is very useful in making sure that those who are desperately unwell get the very scarce medical resources and they can get well soon and come back to their families. So thank you for joining us today. We will be going through how to identify a COVID patient's symptoms, how to ask the right questions, and make sure that the patients you are interacting with are safe to be at home. Welcome back. So we're going to talk about vital signs and how to assess a COVID patient safely, as discussed before in the previous session. And as you know, it is an initiative of Rajiv Gandhi University of Health Sciences and Swami Vivekananda Youth Movement in the name of JeevaRaksha Trust. So vital signs, how to monitor patients and what are really vital signs? Vital signs are a measurement of the body's basic function. So in a common man's parlance or terminology, it is those signs put out by the body which tells you that the body is actually alive. So do you want to hazard a guess what they are? I'm sure you're thinking heart rate, blood pressure, temperature. So you're along the right line. So temperature, which keeps us warm. As you know, when somebody sadly passes away, the body becomes cool. So the fact that the body is warm suggests that the body is alive. The heart rate, which is expressed as pulse rate through the wrist, that is where we normally check it. You can also check it in other parts of the body, is also a sign of life or a vital sign. The respiratory rate, that is the expression of the working lungs by air going in and out of the chest cavity, is also a vital sign, as is the blood pressure. So you've all seen videos or yourself been put in a place where blood pressure is measured using a cuff around the arm. So blood pressure is a sign of life, and so is nowadays oxygen saturation. So before COVID came along, oxygen saturation wasn't considered as a main vital sign. It was always called as the fifth vital sign. The first four we described are the actual vital sign. So nowadays with COVID, saturation is also a very vital part of assessing somebody's well-being. Hence, oxygen saturation has been included in this list. So what's body temperature? As we mentioned, it is a sign that there is cellular metabolism, or glucose being burned in the cells of the body that creates the temperature. So the normal body temperature, we are now using Fahrenheit because of all the thermometers having Fahrenheit as the main measurement. So 97.8 to 99 degrees Fahrenheit is a normal body temperature, and anything above 99 degrees Fahrenheit is considered fever. If the temperature is below 96 degree Fahrenheit, it could be that that part of the body was exposed to cold, like an air conditioner blower is directed at that part, or you had an ice pack there, or you were riding in a motorbike with no helmet on and somebody is doing temperature on your forehead. On a cold Bangalore morning, you can imagine that the temperature is going to be low when measured from there. So it is used, digital thermometer is used nowadays to check the temperature, and preferentially one with an infrared scanner so that there is no touch involved and there is no risk of spread of infection. What is pulse rate? It is a measurement of the heart rate, and it is literally the number of times the heart beats per minute. Normal pulse is between 60 to 100. Mind you, if somebody is emotionally upset, they've just done exercise, they've had an injury or pain, the heart rate will go up, and so does it go up during illness. So all these other things like pain, stress, exercise related fast heart rate settles with rest. So this is why it's important that we should measure the resting heart rate. So the heart rate when somebody is just woken up from sleep, for example, is the resting heart rate. And how to check pulse? It is easy to check pulse nowadays because most of us have got a saturation machine. So the big number on the saturation machine, which will go up only to 100, is the percentage saturation of oxygen in the blood. The smaller number, which changes with every pulsation that comes on your screen, is the heart rate. Otherwise, as shown in this picture, you can put 2 or 3 fingers onto where the fingers are shown on the wrist, that is where the radial artery is, and you can measure the pulse. You basically look at the 12 o'clock sign on the clock, wait till the second hands get there, and then you start counting the pulse rate under your finger, and wait till the second hands comes all the way back to the 12 o'clock sign again, and that gives you the heart rate over a minute, which is called the pulse rate. What is oxygen saturation? It is the saturation of oxygen in the blood, as I mentioned earlier, and the normal is between 95 to 100%. Because it's a percentage value, it never goes above 100. It can be measured with a now familiar device called a pulse oximeter. As you can see, the finger goes inside the clip-on part of the pulse oximeter. Make sure that you haven't got any nail polish, varnish, or anything which could interfere with the spectrometry reading. That is, it uses some light waves to assess the percentage of hemoglobin which has oxygen attached to it. Now the 6 minutes walk test. In the last presentation, I promised you that I'll be talking through the 6 minutes walk test. Because you can't assess the respiratory rate or the well-being of somebody over the phone, this is the most effective test you can do to see if somebody's lungs are functioning well and COVID hasn't attacked their system very badly. So I'll explain the 6 minutes walk test. Just imagine yourself picking a time when you won't be disturbed for the next 6 minutes. So you haven't got milk boiling on the stove, for example. Your phone is kept well far away from you. And if you've got little children, they're being looked after by somebody else. So you will not be disturbed for the next 6 minutes. You first put on the saturation monitor on the tip of your finger. You measure what the saturation is, write it down. You choose a flat surface to walk. It can be walking to and fro, no problem. You don't need to continuously walk in a long distance. It can be just walking in a loop. But the important thing here is that you have to walk in a flat surface. So you're not going up an incline or coming down a hill. And you walk up to 6 minutes according to your watch. And you don't need to check your saturation at that time. Just leave the saturation monitor on. And after the 6 minutes is completed, you look at the saturation monitor to see what the saturation is showing at that point in time. You will notice two things. Your heart rate would have gone up because you've just done 6 minutes of exercise, and your saturation could be the same. Usually it will be better because you're breathing a bit faster, more oxygen is going in, your lungs is working normally. So ideally it will be better. But if COVID has affected your lungs, then in this case the saturation will be lower. And what you're looking out for is saturation dropping by 3 or more percentage points. So say you had a 97 saturation, if it is now showing 94, even though 94 is considered normal, a saturation of 94 denotes that your lung is not coping very well with the increased demand. And obviously, if your saturation goes below 94, even if it is not a 3-point drop in your percentage point, so you had a saturation of 95 at rest, and you do this test and you find that the saturation is now 93. That also tells you that despite your respiratory rate, your breathing increasing, your lungs is not going to get in as much oxygen as it requires for the body. The other important thing to remember here is when you're doing the 6-minute walk test, please don't wear a mask. You should be mask free, and you shouldn't be obviously not attached to any oxygen or any other supplemental gases. So just going back through 6 minutes walk test again, where the pulse oximeter, measure the saturation before starting, flat undisturbed continuous 6 minutes walk, and afterwards you measure it again. The danger signs are there is a drop of 3 percentage points or more, or your oxygen saturation is 93 or below, or you feel severely breathless. You can't even complete the 6 minutes, or you've somehow managed to complete the 6 minutes at your normal pace and you're so short of breath you can't catch a breath because your lungs is not working well. So even if your saturation is 96, for example, you haven't dropped 3 percentage points, but you feel that you're very short of breath, that also means that your lungs is not working very well. So in that case, you should be consulting a doctor, or in our case as volunteers, when we call up, if they tell you any of these three signs, you ask them actually, how was the 6 minute walk test? And you take down what they say. And if they denote that they had any three of these problems, then it clearly suggests that this patient should be escalated to one amongst the medical team. So monitoring the vitals, for our door-to-door patients, we will be handing out a chart similar to this, where they can measure their temperature, their heart rate, their oxygen level or saturation, and generally how are they feeling? They're feeling normal, they're feeling better, they're feeling same, or they're feeling worse. They can denote the same thing about how their breathing is. Breathing is worse today compared to yesterday, it's the same, or it's getting better. So we would advise them to document this, and then when you talk to them the next day, you can assess globally how is a patient feeling, and depending upon that, you can make a judgment whether this patient needs a medical consultation. So when to seek medical attention? If the patient or the caregiver, while monitoring the health, they suggest that there is increased difficulty in breathing, they're becoming more and more breathless, or the fever is not controlled, they're taking paracetamol 650 milligrams 4 times a day, but the temperature is not getting controlled, or the saturation when they measure it is below 94. So 93 or below is a bad sign, 94 or above it is okay. Persisting cough. So first 5 days you expect fever and cough, but after the fifth day as well, if the patient is having cough, that suggests that the lung is involved. Persistent pain or pressure in the chest. So any compression like pain, any tightness on the chest suggests that there could be blood clots in the blood clots in the heart. That is also a danger sign. This patient needs to be seen or spoken to by a doctor. If you noticed that the patient is more confused, they don't know what day it is, they don't know what rough time of the day it is, or they are forgetting to have lunch, or they're coming back after lunch, soon after lunch, and asking for lunch. In most cases, this suggests that they're more confused than normal, or if their conscious levels are going down, they're not waking up, they're very drowsy. Anything like this suggests that this patient will require more medical input and they should escalated to the medical team. So the medication I have given you as a handout what the medications are, their doses are. So I'm not going to go into detail about medications. It talks about paracetamol. It talks about a tablet called ivermectin. And after 5 days, if the breathlessness persists or the symptoms persist, you have to give something called budesonide, which is an inhaler. And after 7 days, if the symptoms are persisting, you might want to go on to some steroids. So that is the current guidelines from All India Institute of Medical Sciences, as well as you need to tell the patient to continue with the medication that they normally take for their high blood pressure, diabetes, stroke, heart attacks, whatever else. So just going through the national guidelines, as you can see, we divide COVID into three: mild, moderate, severe. And for the mild category, it is home isolation. Moderate, they need to be in a ward with oxygen, and severe should be in a hospital where there is an ITU or an ICU, and preferably in an ICU bed. And the national guidelines suggest that mild cases should be seeking immediate medical attention if there is difficulty in breathing, respiratory rate is above 24, or the saturation is below 94, and a high-grade fever or severe cough, especially after 5 days of symptom onset, or if there is any of these or the comorbidities as we discussed are getting uncontrolled, they should be referred to a doctor. And we have discussed these tablets, so I'm not going to spend any more time on that. You're aware of what tablets they take. And just coming back into high risk again, just to summarize, high risk is anybody who is older than 60 years of age, someone who's got heart problems like diabetes, like high blood pressure or heart attack kind of illnesses, somebody who's known to be a diabetes patient, somebody who's taking medication which makes them immunocompromised, lung, kidney, or liver diseases, strokes, or someone who is particularly overweight. So these are the people who are high risk for developing severe COVID and maybe even having a fatal or deadly illness out of COVID. So we're coming into scenarios again. You're familiar with this. We have got 4 scenarios. I'm now going to hand over to the facilitator to take you through these scenarios so that you can make decisions depending upon the decision tree that we've just taught you, and decide whether the patient is safe to stay on at home or whether they need a medical intervention. Hope this explains to you how to manage these patients safely at home, and any doubts you have, you can either put through the chat window if this is being presented through an online forum, or take it up directly with the facilitator after the session is over. Thank you and good luck. And once again, thank you so much for volunteering to look after our countrymen in this time of dire need. Thank you very much.